all for joining the call. Let's kick off the session with introduction of speaker, Mrs. Manisha Mantri, who is a Joint Director at C-DAC Research and Development, Pune. She is associated with C-DAC over a decade and leading programs and projects of HPC Medical and Bio-Informatics Applications Group. She been one of the primary stakeholder in design and development of telemedicine solutions for our country. Also played an important role in development of nationwide healthcare information store. Also, not to miss out, she is a co-author of a book titled Electronic Health Record Standard Coding System Frameworks, which been helpful in design and development of process and regulatory standard of for Indian government. Currently, Manisha is leading the activities of the National Resource Center for EHR Standards, which is established by the Ministry of Health and Family Welfare of India. Today's, let's grab this opportunity to hear from her about her experience and learnings of applying the data science techniques in healthcare domain. So thank you for accepting this invitation, and over to you, ma'am, for further proceeding. Thank you once again.
Thank you, Professor Sonika, and thank you for this generous introduction. First of all, thank you, Beats, for inviting me for this tech talk. To start with, let me share my screen and let's do a one check if the screen is visible.
Yes, it is visible.
Thank you. Shall we go ahead?
Yeah, we can start. Thank you.
Okay. Yeah. So good evening, everyone. And today we're going to talk about how we can apply data science techniques in healthcare. I'm Manisha Mantri, and I'll walk through a few of the applications of data science in healthcare today. Yeah. So to start with, in agenda, I'm going to cover today an overview of data in healthcare and what are the different healthcare data science opportunities out there overall and in India specifically, and how data science in healthcare is different from any other fields and the application areas, and then few of the applications of data science technologies in healthcare, and few C-DAC initiatives that that my team and few other teams in C-DAC are working on. So to start with, data in healthcare, there is no doubt that the healthcare data satisfies all the 3 V's of primary characteristics that are defined by Douglas to be the big data candidate, and data science is all about data. So in healthcare, volume is tremendous. We have electronic health record systems, we have EHR systems, EMR systems, we have the PACS systems, which archives the images, medical images. We have a lot of patient-doctor conversation notes, the genomic data. So talking about volume, it is tremendous. And then when we try to look at velocity, it's about speed of data processing. So in healthcare, we know how the critical ER systems are, how the ICU works, where we have this continuous healthcare data, the time series data is getting generated. We have daily OPDs, IPDs, the health monitoring, we have tracking apps for health devices, we have telemedicine. So there is huge data velocity. And talking about variety, yes, we do have the structured as well as unstructured data in healthcare. We have medical images, we have videos, signals, and a lot of domain-wide data. And when we try to look at the third added V in all these 3 V's is the veracity, where there is a variation in the data quality as well as reliability. So we know that the healthcare data is disparate, and there is a difference in the quality of data that's get generated at different levels in healthcare system. So just let's have a look at the heterogeneity of the health data in terms of its variety. When we see healthcare data, we have patient demographics as a completely different health record type, where we capture the patient related demographics related parameters. We have diagnostic images like X-ray, MRI, CT scan, where we capture a lot of information about the finding site, the laterality of the diagnosis, the information of the series, and so on. And when we try to see the laboratory reports, the test reports, we have completely different types of record, where we have the complete structured data capture, putting all the information, all the values, the number, where unit of measurement, the method of measurement is very important when we start talking about hemoglobin, RBC, WBC count, and so on. And then there are diagnosis and the observation record, which are important to document the disease, the different observation related to patient, and then the medication, which we commonly call as prescription record, where we have the health information, which kind of include the name of the drugs, medicines, the route, the dosage, the duration for which the data is to be taken. And when we try to see more, get into more deeper into health records and try to see the health data semantics, we see that the multiple clinical concepts are spread across health records, having different connotation, different synonyms. For instance, few of the example that I'm putting here is the myocardial infarction, which we all know. It has multiple synonyms. People call it heart attack, people call it just an abbreviation as MI. You could call it infarct of heart or cardiac infarct. So these are the multiple examples. For an instance, we take the SARS-CoV-2 as the name of the virus. Then it has 2019 novel coronavirus, 2019 nCoV, and a full form of SARS acute respiratory syndromes coronavirus 2. The similar go for family history of stroke, where people very frequently the healthcare providers write FH:CVA, like uh, cardiovascular accident, right? And then multiple options, synonyms for even fever, for that matter. So now let's see, we now talked about the data in the healthcare and how it is structured. Let's try to see how what are the different healthcare data science opportunities are out there. So talking about healthcare opportunities particularly, we know that healthcare data is consistently growing, and it is increasing every year. It is estimated that there is approximately 30% of world's data volume is being generated by healthcare industry. It's just a recent in the recent research. However, we see that the public expenditure on healthcare and the long-term care is also expected to be increased by 1/3 by 2016. That's what another research says. And 80% of health system data is unstructured. However, it is very clinically relevant in terms of taking insights into data, getting some outcomes, and trying to help to improve the overall healthcare uh, delivery in the country and across the globe. So yes, definitely data science technique can help extract such an hidden knowledge that could change life of a patient. So extracting this knowledge is a fastest, least costly, and most effective path to improve people's health. And in fact, if you kind of check the Gartner's top prediction for healthcare and life sciences in 2022, the top two were mentioned as the hospital at home being getting used, where the with the COVID-19, definitely we have got this sense and the feel that care can be delivered at home. That barrier of not having care at home is now reduced. It just not only for the chronic diseases, but you can go further to extend care provision at homes. So that's going to be the top thing, and where you imagine what kind of data will be generated. The patient's health will be monitored. You will have a lot of monitoring devices. You need remote systems to look at the healthcare, give the care plans, give treatment, and so on. So there is a huge potential. There is a huge market in healthcare. And the second topmost prediction is about having a healthcare marketplace where the payers, the consumers, the providers, all of them will be available, and patient can choose based on the requirement, based on the value proposition. So again, you will have to have the data online to be able to deliver care across different platforms. So yes, there is a healthcare opportunity, a lot of opportunity. And when we specifically start talking about India, if not, I would like to introduce to all the participants that we have Ayushman Bharat Digital Mission being in launched sometimes in 2020, not sometimes, I would say August 2020, our Independence Day, when our Prime Minister have launched the scheme, where the aim is to develop a complete whole backbone which is necessary to support integrated digital health infrastructure in the country. So you have all multiple building blocks of healthcare, including your healthcare registries, your provider registries, your facility registries, the patient registries, everything in place, a building block which will allow different hospitals to share data between each other. So you are going to get a lot of data in the structured format, in the digital format soon in India. And there was a pilot implementation done of this scheme in 6 union territories. And after its successful implementation, a nationwide implementation is already announced just few months back on September 27, 2021. So this is a big opportunity of digital health in India. Now try to see the data science opportunities. So when we kind of try to look at the data science opportunity, we know that there is a huge advancement in ML and AI algorithms. It is not the way it was there earlier. We have the ability to learn with the high dimensional features. We can have semi-supervised as well as unsupervised learning. There is a lot of advancement. Even the modern digital deep learning techniques have come up, which can be utilized. And then there is this democratization of machine learning is also happening. You have a lot of high quality open source softwares, like you have Python's scikit-learn, you have the TensorFlow, you have Torch, you have a lot of other algorithms, open source libraries available which you can utilize for taking care of your data science requirements. Now, on top of it, there is something called standardization, which is also important if you want to have data in a good format, which you can use, you can process for the data science purposes. And in India, we have the standardization also initiated. In 2016, EHR standards for India have been notified, and there were standards recommended for data content like SNOMED CT, which is clinical terminology, ICD-10 for medical coding, diagnosis coding. We have LOINC for observation, laboratory observation coding, and also the data structure and data exchange standards also notified, amongst which FHIR being one of the health data standard adopted by Ayushman Bharat Digital Health Mission itself. So all the data that is going to come in some or the other structured format for sharing within the ABDM, Ayushman Bharat Digital Mission ecosystem. And there is a FHIR implementation guide also available for it. And the few other standards like OpenEHR, ISO 13606, which is the standard for sharing of data, and even the DICOM standard for medical images. So these all standards have been recommended, and more hospitals, more and more government programs are demanding healthcare softwares and applications which are standard compliant. So that is an added advantage in India, and I think a lot of initiative already there abroad. You have ONC notification, ONC program in US and other countries there. You have NHS in UK. You have the National E-Health Authority in Australia, who takes care of digitization and standardization in their own specific countries. So now let's talk about data science in healthcare. We talked about the healthcare opportunities. We talked about the data science opportunities. Um, so from predicting treatment outcome to curing cancer and making patients more effective, and the data science healthcare has proven it to be valuable contribution for the future of this overall healthcare industry. So there are three main factors that we can see here: advancement in technology, growth in digital consumerization, because we are more and more digital savvy now. With pandemic, we are also trying to look at getting online treatment through telemedicine, and also there is a requirement to fight with the costs, healthcare costs that are associated. So what is it all about applying data science? If we kind of see the courtesy from Hilary Parker from WITS 2019, this was a slide that she has presented, where you can see that what we do is the data science is an interdisciplinary field that extracts knowledge and insights from many structured and unstructured data. And we use multiple scientific methods. So we collect data, we prepare the data, and we do multifold processing of the data through applying various models, transforming the data, visualizing it, and then we kind of use multiple methods and models of data science techniques like data mining, machine learning, big data, and then we try to infer some or the other information from it. So let's try to see it from the healthcare perspective. How can we apply data science in healthcare? So the process remains same, but what changes is the way we collect. We need to have the data availability, data identification, and the access. We need to prepare data with a lot of consistency and the inbuilt knowledge about the data. And ultimately, it is very, very domain specific, data specific, and the models are customized to apply for the similar problems. And that's how, if we kind of see, this is how we can see data science application in healthcare. Now, what could be the data science goals, healthcare data science goals particularly? So we have data coming from various systems. We have EHRs, we have medical images, we have clinical node, genomic data, public health data, behavioral data. We want to take all this data, process it, and try to find some insight, do some analytics on top of a data to ensure we have the right care given, right provider chosen, right innovation done, a right value provided to the patient by bringing in right living to the patients all over. So the best example I would say of the data science goal here is the response to the COVID-19 pandemic, right? Where we try to improve the information collection, we try to provide ongoing and accurate estimation of the infection spread, and we try to find out what are the systems, health systems available based on the demands, and we try to assess whether these government policies are also getting effective. So a lot of agencies have done all of this. This all is very much possible, was possible only because of data science. So now let's talk about what is then more unique about healthcare data science, why it is so difficult. So let's see the healthcare scenario now. When we try to typically look at the healthcare scenario in India, we know that health is a very much state subject. So all the regulation, all the requirements changes from state to state. We must have been hearing that RT-PCR is mandated in Maharashtra but not mandated in Bangalore, or mandated in Chennai but not mandated in Delhi, and so on. Why? Because all the decisions of health are taken by state. And healthcare, now adding to the first layer, healthcare is a multiple domain of care. It's just not very straightforward like any other domain like finance. We have the multiple domains. We have ophthalmology, we have pathology domain, we have general medicine, we have surgery as a very intense and a specific domain, we have dentistry. So many domains of care are involved. Then we have public as well as private setups into it. So adding to that, the healthcare also, the health itself also affects because of a lot of other parameters. Our social parameters, our economic parameter, the environment in which we are staying. So whether you are staying in a tropical environment or any other environment, geographic location altogether, the genetics, and so many parameters are involved which affect health. So it's not a very straightforward formula in terms of health. And data is also patient centric, so it's not system centric. So a lot of patients may like or may not like to share their health data, so you have always this problem of data availability. So capturing a clean, complete, accurate, and a formatted data for use in multiple systems is an ever-going battle in healthcare industry. And this is not only state in India, it is state everywhere in every country, even today. So, but the problem is data is key for data science, and that's what makes data science in healthcare a challenging task. So again, try to look at why it is also seen as a uh, differently altogether, because we take a lot of life and death decisions while we apply data science algorithms. We need robust algorithms. We need a lot of check and balances to be done to build and deploy the ML system. Like, you have the driverless cars, and how dangerous it would be if you have small error in your algorithm. So you have, for example, the driverless car uses the AI for autonomous driving. So the similar problems are there in healthcare. We need fair and accountable algorithms here. And then there are they in healthcare, we don't have a lot of data which you can use for supervised learning. Many questions are mostly unsupervised, are about unsupervised learning. For example, if I want to kind of check, ask the question such as characterize the type of people that are highly likely to be readmitted in the hospital. So for this kind of questions, you need to go for unsupervised learning, which makes it more and more difficult. And there is often very little label data available, typically for clinical NLP. And that's where it motivates to use semi-supervised learning algorithms. You can have the mix of the algorithm. And just few more slides about why and how it is different and difficult. Sometimes you have the small number of samples available, for example, in rare disease cases. And in that case, you have to kind of look for the possible other data and train your algorithm on that data, which is of the healthy patient. And it really affects the way your algorithm performs. So you need to model the problem very, very carefully. There are a lot of time missing data, varying time intervals. There are censored labels. So there are a lot of information that patients may or may not wanted to share, the gender specific preferences, any specific disorder that they don't want to disclose. So you may have a lot of time missing data also. And then there is a difficulty to de-identify such a data. Because you need a lot of data sharing agreements in place because of the data sensitivity. The research body clearance are needed. Many times consents are required to be in place. There are laws and regulations for data, which makes this field more and more difficult. I'm not scaring everyone, but I'm telling the ground realities. Then there is then difficulty of deploying such ML algorithm. The commercial current softwares are difficult to modify, and then data is also there always often in silos. So we hope with the Ayushman Bharat digital mission we will have data available from multiple systems and centers, and every organization, everyone recognizes there is a need of interoperability, but the progress is very slow at all the level, whether it is public or private organizations or the vendors for that matter. Now, these are the special skills that you would expect to have in the healthcare data scientists. Um, the general skill that we all know that you need to understand and have the skill of dimensionality reduction. You need to have the machine learning you need to know the machine learning models. You need to kind of know the time series analysis models. You need to you need to know natural language processing. These are the very widely used techniques. You need to have the data analytics skill. But apart from this, when you kind of try to look at healthcare specific skills, you need to know the domain knowledge. It is very crucial for data scientist who plans to work in healthcare. Uh, she should be able to be well versed with healthcare databases, the types of medical documents, medical coding, classification systems, uh, the regulatory agencies' requirements. Um, so, for feature learning in particular, it is impossible to do without domain expertise. The data scientists should also understand the medical variables, and they should relate it with the health outcome. So it's very crucial for designing a correct model and getting the correct results. So, for example, the medical coding and classification system knowledge is also needed. Like you have the current procedural code, which are generally used in USA, which are being developed by AMA, American Medical Association. There are around 10,000 plus procedural code which are used in general procedure coding in health records in US. There is ICD, which is International Classification for Diseases, which is provided by WHO, World Health Organization. This has been used, adopted by more than 100 countries, and it has around 70,000 codes, which you should understand in order to correctly classify, correctly identify a particular disease, a problem, or for doing any statistical analysis. And then the clinical terminologies like SNOMED-CT, which is provided by the SNOMED International, where India is also a member of SNOMED International. SNOMED-CT has more than 3.5 lakh unique clinical concepts which are documented in health record. It has 15 lakhs, about 15 lakhs clinical terms which are used. And there are the linkages between multiple clinical terms. So it uses ontological language for defining clinical term, which is very helpful when you try to do NLP or when you try to process the medical records or health data. And then there is LOINC, which is the standard for coding laboratory observation, specifically in pathology domain, where, for example, you want to kind of document that how many leukocytes were there in cerebral spinal fluid by manual count, like for example WBC CSF manual method. Then there is a code for it, and then you put data, so you can very well know what was the unit of measurement, what was the method of observation, and what exactly was being observed. So all of this information can be deciphered from all these codes and the systems. And it's very important to know these healthcare specific concepts and the nodes. Now, let's try to see the applications of data science techniques in healthcare. So we talked about how healthcare is structured what are the opportunities and what skills one should have to proceed with data science in healthcare. So let me just talk a little bit about, uh, fine, go ahead. Let's go ahead. So the first application I'm trying to pose, so these all application what I am explaining are not complete, definitely. These are based on the knowledge and experience that I have got over the time. And there could be many more applications as such, but I'm just trying to give some glimpse of the data science applications in healthcare. So first and foremost, the emergency department. I am sure all of you at some or the other time have visited or have heard about the emergency department, where the patient gets admitted on a critical note in the trauma state or for any specific emergency, healthcare emergency. And we all know that it has limited resources. It is the work there is very, very time sensitive, and a lot of critical decisions are to be taken care of. The department data contains a lot of things, including the MD comments, specialist consultation, lab results, any triage information which is in free text, and then the physician document, repeated vital signs which are being captured, measure every 30 seconds or so. So a lot of data gets generated over here. So what could be the applications in the ER or ED for that matter? So we can use data science to kind of trigger the clinical pathways, define the clinical pathways. So looking at the data, we kind of define clinical pathways, what should be done in such a situation or such a condition, and then create such a clinical pathway. And the system automatically triggers such pathway based on the information or the input received while the patient is in ED. And these can be taken care during the real time by analyzing the data. So this actually would help to reduce in-hospital complications without increasing the further cost. So for example, what happens in ED, they do a lot of tests, although a lot of things happens in a cognitive manner at the back side. There is a processing happening at back of the mind of clinician or back of the mind of the healthcare providers. But what if we provide a support system to them which can help them take decisions faster and quicker, because the place is very, very time critical. And then we can kind of think of giving context specific displays to such in such scenario. For example, automatically placing some specialized order set based on the patient's condition. Say for example, patient complains of a chest pain, you immediately show that you may want to provide all of these direction initially, place an IV, provide a continuous pulse oximeter, provide a cardiac monitor, and then maybe give a aspirin dose, which is the lower dose of aspirin, maybe 325 mg oral tablet. And maybe you can order for the CBC differential and other laboratory tests and any other conditions that should be possibly done in such a situation. So this makes the overall workflow altogether handy for the healthcare providers. The another application would be risk stratification altogether, where you can kind of predict the likelihood of mortality or admission to ICU of the patient who is in emergency department. This will help hospitals to kind of manage the resources, manage the bed availability of the bed, manage the transfers, and also keep the family informed about what is going to probably happen, if not immediately. And ultimately improving the overall clinical documentation in terms of providing some type aheads, some readily available data sets for diagnosis, for initial diagnosis, and so on. the second application would be from my angle would be the hospital and care workflows, which are very critical to care. And we know that the doctor to patient ratio is very low, especially in India, and everywhere we have always the crunch of the doctors. And it really affects the cost and the economy of the country if this domain altogether is not taken care of. And there is a term recently which is coined, which says as value based healthcare, where patients reported outcome and the total cost of the care determines the decision how much should be paid for a particular treatment. And this is now becoming a very guiding principle for all the different countries. Everybody is trying to talk about and try to see how value-based care can be can be added or can be introduced. And this can be, the healthcare providers can be paid based on their performance measures. Say, for example, the provider is not paid for the time which is spent for treating the patient, but for the outcome that has come of the treatment. So in order to make such value-based care possible, we need data, right? Data must be collected, it must be aggregated and used for review, for analysis, and the patient feedbacks. So a lot of requirements would be there. And talking about workflows, then the conditions within a hospital are highly dynamic. We know, and we see many times, and we have experienced it on our own. We also some of the other day went to the hospital. They are often dependent on huge number of interrelated factors. Uh, the the need of the patients, the multiple departments, the staff members, the assets, and this volatile situation makes many form of workflow orchestration to improve productivity highly challenging. It is very difficult unless the hospital staff and the administrator have a proper overview of how the hospital operations are going on. So talking about few of the applications here, uh, one could use data science to automatically identify the current operational state of the hospital. How? So we have data coming in from multiple systems. So one can integrate and make that data available at one location, from ER system, from EHR, from the nursing notes, from the tracking system, where the ambulance is there. So all of this, if we kind of integrate, we can use data science technique, we can use data analytics to at least try to provide the current operational state of the hospitals to the administrator, to which helps them to better plan, better look at, and better utilize the resources. Again, data science can allow us for more effective decision making through the clinical pathways. So I talked about clinical pathways earlier. So such clinical pathways can be integrated into hospital environment, even for the general interdepartments, which can help in making decisions effectively and help treating the patient much faster than the regular period. So of course, data science doesn't replace healthcare providers, but they become a tool, they become a helping hand to the healthcare providers who can use them. And then there are multiple such applications, like you can look at the data and analyze how can you reduce the infection spread due to hospitalization. There are a lot of cases of hospital-borne diseases, and there was one real good study which was done, and they kind of studied the uh, different processes that are happening in hospital, and they identified that regularly changing or regularly removing the hospital waste from each and every individual hospital rooms reduces hospital-borne infection to 20-25%. So these kind of insights can only happen if you know the schedules of cleaning, if you know the schedules of the staffing and the rosters of the medical staff and why and what of it. So all of this is possible if we try to use data in appropriate way. And then you can do workflow optimization, process improvements. You can automate a lot of processes by looking at what's going wrong, where the things are lagging and how it can be improved. Then you have AI assisted surgeries, AI assisted treatment plans. It's altogether a big area of work. I'm not sure if you have kind of seen one of the web series which is called The Good Doctor or A Good Doctor. I don't remember rightly, but there in one of the series, the two doctors try to plan a surgery, and they use a complete, they kind of depict use of a complete AI assisted treatment plan, and they try to put a particular stent or some device, and they try to see whether it works, and it doesn't work for so many times. They repeat it, and then when they succeed, they use the similar plan in the treatment of the patient. So a lot of things are possible, and there are a plethora of opportunity. So Kaiser Permanente, which is one of the institute which has worked with the Mental Health Research Network to analyze the EHRs and the results of the standard depression questionnaires that they take from the patients. And they identified with the great accuracy which patients could have the high risk of attempted suicide. So these kind of things are very much possible. And there are a lot of success stories about it. Now, talking about one example, I would talk about workflow and use of AI and ML to detect the frauds, rather, I would say, in healthcare system. So you all must be knowing about the Ayushman Bharat digital scheme in India. It was again launched sometimes in 2019, where this is a flagship scheme of Government of India, and it has a vision of having a universal health coverage for every individual. And the currently Ayushman Bharat PMJAY scheme is the largest health insurance scheme in the world, and it aims at providing covering about 5 lakh per family per year for secondary and tertiary care hospitalization for over 10 crore poor and vulnerable families. So it actually covers the bottom 40% of Indian population. So in this scheme, what was happening is there were some malpractices noticed, and that the National Health Authority team there has developed a framework, which is AI and ML based framework to detect, prevent, and defer the fraudulent and abusive activities in the scheme, overall scheme. And it could found around 40, around different anomalies in which in 48 hospitals across the country, out of which 31 hospitals were suspended due to few of the reasons, like doctors' inconsistencies during working hours in the public hospitals. The doctor in the public hospitals were illegally referring the patient to private hospitals, and the referring patients from private clinics to private hospitals, and so on. So there were multiple anomalies detected and these hospitals. So this is one such good example of application of AI/ML. The next area I would talk about is the decision treatment and management, where we know that healthcare is the multi-layered system. It is developed specifically for preventing, diagnosing, and treating disease, and the key element to it are our healthcare practitioner. And depending on the severity and the cause of the case and the cases, the providers take different decisions, and they need different forms for taking such decisions, like the medical history of the patient, the clinical data, the other personal or private details and the data. So in all of this process, data science can immensely help in assisting healthcare providers. So what could be the applications? The simplest one is to eliminate prescription errors, right? Or allow take them decisions on the fly. Say, for example, I have said that I'm allergic to paracetamol, and then the doctor tries to give me a prescription with the medicine of paracetamol, and the system gives a pop-up that, you know, the patient has allergy to paracetamol, and then you need to kind of try and give some other alternatives and provide some alternatives which are given for the similar problem or similar issue somewhere within the department, within the hospital, or in the knowledge base. So like this, a very simple decision support system can be built in, which can help them to, you know, reduce these errors and to prevent any adverse effect or allergies which would cause in future for patients. Even a few examples like finding markers of disease stages and progression. So data science help them to kind of see how the disease has been progressing for this particular patient, and then try to apply the similar apply the same progression for the similar patients with the similar demographics or similar patterns, and then predict what is going to happen, or give a change the treatment plan, give the better treatment. So for example, I would you would call, what is a typical trajectory of a female diagnosed with osteoarthritis? So if I kind of ask this question with adding few more parameters, say for example, female with the age XYZ, female with the occupation as occupation in IT, or female with the occupation in banking. So all of these, if I start adding, can I get some outcome? Can I get some insight which can help me to treat the patient? And then you use predictive analytics for improving patient care, the chronic disease management also, and increasing the efficiency of supply chain of pharmaceutical logistics. So for example, you think that the patient is going to require XYZ, and you are a very small clinic, then you can also think of having some advanced logistic of such pharmaceutical requirements or medicinal requirement or dosage requirement, especially for chronic patients like suffering from kidney transplant, going through kidney transplant, or going through some certain level of blood transplant. So in such cases, and then even data science can help in better understanding of triggers of the chronic diseases. So for example, when would this chronic disease get to its peak, or when the patient needs real help? So that will help you to prepare emergency response or forecast admissions, and so on. The third most important application area is medical imaging. You will see a lot of literature of use of data science in medical imaging, especially AI, ML, and the different types of algorithms, new models for supervised, unsupervised learning. And why it is very important? Because this is the first step for diagnosis. And please give me a time check, right? If I am kind of running out of time, huh?
I hope we already covered 8:20. So, and there are a few questions as well.
Okay, so let me kind of run through as fast as possible, as quick as possible. And then there, the data quality is also critical, right? So a few of the examples here would be, we use image processing technique like image enhancement, image reconstruction, age detection, which can help in better diagnosis. Typically, when we kind of talk about medical imaging, we know that there are a lot of inner body part that you have to review, and it is sometimes very difficult to find microscopic deformities. So image processing, image enhancement techniques, AI/ML techniques is specifically into it can help to do that. A very common example I would say is the pneumonia detection from X-ray images. In 2020, 2021, there are a lot of literature, Kaggle competition, Kaggle source code for it. And I hope you guys have explored, or whoever has interest, they can go and check that. It has triggered after COVID-19 because a lot of symptoms of COVID-19 were seen equivalent to pneumonia, and the patient's X-ray could be chest X-ray could be taken up to detect that. So a lot of people try to do a lot of R&D into it. So people can try that. A few examples like Google AI. You must have heard that they use the deep learning model for diagnosis of almost 26 skin diseases with the accuracy of 97%. And there is something called Google Lina, which is the lymph node assistant, which actually helps to identify metastatic cancer, which is one type of a breast cancer, with also a 90 plus percentage of accuracy. Even Google Brain AI have worked with some of the hospitals in India, where they have tried to detect if the diabetes will hamper the eyesight of the individuals. So the typically it is called diabetic retinopathy, where the patient's the retina is being referred and processed and seen eventually what kind of changes will happen in the retina through the different retina images of the patients. And they have tried to see if you are diabetic, then whether your eyesight will affect or not. And the algorithm has 98.6% accuracy. It is being tested in Arvind Eye hospitals, Sankar Netralaya, and then Narayan Netralaya also. One such example of medical imaging, I'll not go in detail on it. It's about kind of trying to see the staging of the tumor in prostate cancer case from the ultrasound images. The next area would be the genomics, where a lot of research has been already conducted and it's going on, right? And it's where, for instance, if we kind of talk about genomic, currently you have the powerful computations available, and then there are a lot of issues earlier with genomics which can be solved right now. It is a data intensive field where huge data sizes are there. You need a lot of computational cost. You need a lot of time. So with advancement in high performance computing, advancement in systems availability, and also with the good big data algorithms, this field is now has a lot of traction, and there are a lot of work already going on in genomics. And let's see, a few applications that I have noted from my side would be to study human genetic variations and its effect on the patient. One example I would say is everybody would be knowing is one famous Hollywood actress who kind of went through the study of her genomic structure and was identified having the possibility of having breast cancer, and she went through the breast removal surgery. That's one good example of genomics, I would say, which affects really life of patients. And then study of genetic mutation of viruses and the microbacteria over time. For instance, scientists today could now found that the SARS-CoV-2 virus has got different strains earlier this year with one or two mutation. However, the recent Omicron virus has over 50 plus mutation in the original strain, which is very, very alarming. There is a complete S-shaped structure of sequence which is missing from the original gene structure. So I'm also reading over and studying the information, not in detail, but although. And then there is something called precision medicine, where you can find the right drug, which provides a deeper insight and the way the drug react to a particular genetic tissue. So right drug, a precise drug for a individual. This is essentially important in cancer cases where a lot of drug dosage happens to the patient. And then the field has a lot of now open source softwares to work on genomic data. You have the MapReduce algorithm available, which is widely used. Then Galaxy, then Bioconductor. So these softwares are there that you can use. I guess it's not the last, but few more slides remaining. So the next field is drug discovery, and we all know its importance with the vaccinations getting created, developed for coronavirus. It's a time-consuming, high investment, and success-critical field, and it's very important to work on. So how data science can play a role in drug discovery? We can kind of get insights from patients' information, such as the mutation profile and the patient's metadata, to develop model and the final statistical relationship between different attributes, whether these patients are a good cohort for trials, or good cohort for the second phase trials, or good cohort for third phase trial, and so on. And then simulate how the drug will act on a human body, which takes a long time in laboratory experimentation. So even we can do that using big data analytics. As an example, Johnson & Johnson company is using data science actually for choosing which population is to be recruited for the trial, and then who might be the most at the risk of getting sick during trial or after trial, and then also track the pandemic and also forecast the hotspot in future. So all of this is already in place, and many people are working on it. The next field is monitoring and lifestyle, and it's everyone knows it. We have the smart devices, hospital at home concept that I talked about. We have a lot of big data. So here, as an example, I would directly talk about the good example would be Arogya Setu, where COVID alert and proximity sensing is happening. So it's all happening with MIoT, I would say, medical Internet of thing. So here, the IoT and the big data plays a lot of role, and you can use combination of it for solving a lot of problems, like managing patient with psychological disorder like depression, anxiety, give them the care plan, give them a good alerts, even managing patients with degenerative disorders like Alzheimer's, who tend to forget things, and then remind them or tell them what to do next, and so on. There are other applications like Trinitra and Mircam, which are indigenously developed in India and used at multiple hospitals. The next area is population health, where it's very important because you can manage pandemics, natural calamities, and also you can do the reduction plan for chronic diseases or long-term diseases. So population health, here data science plays a very, very important role, because we can, using data science, prevent infection, predict infection, and also control it. So time series analysis kind of algorithm are really, really helpful here, where you can, for example, you can forecast the COVID-19 cases and the mortality rate. You all must have heard about the very accurate prediction of the second wave of COVID-19 was done by scientists from IIT in India, and it was trending, and there were a lot of prediction. Although the third wave didn't match, but that's how it is. And there are so many applications there. Um, and then you can predict the trends of spread of illness, and which can help professionals, hospitals, authorities to take any proper plans for controlling this spread. And the challenges here are again the data challenges, which I think I have covered, so I'll not talk about it. And then few of the C-DACs initiative in which are helping towards data science, I would say. One of the product that we developed is the distributed healthcare store. It's being technology developed in collaboration with Swedish Institute of Computer Science and funded by Ministry of IT, where we kind of developed a distributed scalable healthcare information store where it collects all the data from disparate systems within the hospital. And the software was deployed in JPNATC Trauma Center, AIMS, New Delhi, where we were able to kind of collate the patients, around 3 lakh patients data with around 23 lakh health records. So that now we are kind of working on this data and seeing how can we now get some insights from the data. The second work that we are doing is big imaging data approach for oncology. This is also collaborative work, essentially with the Philips India Research, Maastricht University, Tata Memorial Hospital, and C-DAC. All 4 or 5 partners are working together, where we are trying to look at the lung and the cervical cancer and try to develop a decision support system for cancer treatment. So what it does is it takes all the data, clinical imaging, treatment data, radiology data, combines it, and then pushes it in an de-identified form for other systems to use it and infer whether whether there is a possibly a cancer tumor available or there in the image or not. So it helps in faster diagnosis actually. And then we have the National Resource Center for EHR Standard set up at C-DAC Pune. I'm leading activity of this project where we are putting an effort to standardize the health data, which will ultimately be used for data analysis. And one more product that we have is the genomic, we call it Gamut, which is the genomic big data management tool. It actually helps to understand relationship between genotype and phenotype, which is one of the major goals of biology and medicine to be combined. And it tries to do analysis of different variants like SNPs, and then their insertions, their deletions, all of APIs are available there. And then the last product that we have is HBAT, which is hydrogen bond analysis. It does the analysis of hydrogen bond bonding, including water-to-water interaction. And it uses vector geometry for calculation of angle and distances between the items. And then it can be extended and used for other items also, for other items also. And the benchmarking of this algorithm actually showed that it can have the linear scalability up to 5.3 terabytes of data. And that's all about this tool. And thank you. So I hope it was a helpful presentation.
Thank you. Thanks a lot, ma'am, for the great presentation. So there were a couple of questions. I think most of it already solved or resolved from your presentation as you go on through your slide deck. There are a few more. If you have some time to look at it, it would be great. So just we'll go through the chat box and you can see there are a few concerns which has been uploaded by the candidate.
Sure. So I can see the question from Saurav. It says, how do we decide algorithm is fair? Right, Saurav. Actually, it's about ethical challenges in data science. It's altogether a new topic. of discussion, and we may not be able to discuss it for a long stretch. But I would say that when you design an algorithm, design it for a fair usage, and not for it's all about ethical use of AI, ethical use of AI. So it's an altogether a different topic. So don't use it for try to rather I would say try to use it for the goodwill, rather than trying to find out or spooking into the personal information, or trying to make some benefit out of it. So your algorithm has to be fair. That's what I meant.
Yeah. Question: is medical data can be available to us through any API or FTP server? This is the one from Hardik Patel.
Okay, so I'm not sure which medical data you're talking about. If it is about C-DAC's medical data, then actually C-DAC do not hold any medical data. We work in the project in collaboration, and we get an RB approval from the hospital, and then only use it for research purpose. But the project in which we were working for big data imaging approach, there we from the beginning of the project, we kind of put forward a proposal that this data should be available to everyone, whoever wants to do research, provided they have the access to the data. So that is there. However, talking about in general medical data, if we kind of try to use data for data science technologies, you have some open data sets available. But if kind of I try to see it from Indian perspective, most of the data is from other countries and may not be directly applicable in India. So yes, there is this requirement of availability of data altogether, and I think the National Health Authority is going to trying to work on it to make sure the National Digital Health Blueprint itself states that the government's vision is to make data available to the researcher for improving medical research. So most probably after the whole ecosystem is up, one can register as a data scientist, put the proposal and state the purpose and the usage of the data, and then you can get access to data in anonymized format, in de-identified format for your own research. So that's going to happen, but currently complete medical data is, yes, not available. You have to go through a lot of processes, at least in India, and even in other countries as well, but the open data sets are available.
Okay, the next question is there a portal from where we can get a SNOMED city sample data?
Yes, of course. So I am typing, this is the website where one can go. It's a NRCS. You can just search National Resource Center for EHR Standard, and you can go to the website, and under the different sections, you will find how to get SNOMED city codes for India. And they all are free for usage for every individual within India, for usage within India. Yeah.
And the EHR data as well, like portal to get the EHR data, right? Swati, I guess you're asking this question, right? Can you type it fully to all, everyone?
So EHR data, then again, I just replied earlier question that you don't get health data openly available. You will find some places the data sets there in some research papers through some shared portals, uh, even on Kaggle or other data sources which are there. You can get the data in the anonymized form for your work. But if you want a real hospital data for a completely different use case, then you have to go through RB approval of the hospital to get access of data.
Okay. And there is one concern that, ma'am, can you share this slide deck with me so that we can share across with the candidates who has joined this meeting? They're asking, but like it was really good and informatics for them, add-on knowledge for them. So they would like to have this share slide deck. So is it possible for you to share with us?
Sure, no problem. All is okay, no issues.
Yeah, that would be great help if you can share this. So I will share it with them. Yeah, so it's already been late, and yeah, thank you for the great session which you have conducted today. And definitely, I am hoping that this has been add-on knowledge for all the participants who had joined this meeting. Again, I would like to thank you, ma'am, for your time and delivering such a nice session. Thank you very much.
Thank you.
Thank
Thank
you.
you for the opportunity.
Yeah, thank you all for joining in. So have a great time ahead. Bye.